In this video, we're going to look at shoulder palpation, we're going to look at the bony landmarks, and we're going to look at soft tissue palpation, exactly what you'd be looking for in your examinations.
Okay, so we're going to start our palpation of the shoulder by palpating for inflammatory signs. So just some warmth, redness, tenderness, and just generally getting a feeling around the arm itself. Then we're going to palpate the sternoclavicular joint, and you can test the mobility of this by grasping the clavicle and moving up and down. We get to the sternoclavicular joint by coming medially on the clavicle to where it meets with the manubrium sternum. You can also palpate down the ribs from here as well. Then we're going to palpate along the clavicle to its lateral border where the acromioclavicular joint is. And we're going to watch out at this point for cranial displacement of the clavicle, which can easily be moved inferiorly. This is called a piano key sign, and it's a sign of acromioclavicular joint dislocation. Then what we can do is palpate the coracoid process, which is in the infraclavicular fossa. Flexing the arm forwards will also move the process forwards, and so you can feel this under your fingertips. Here there is attachment of the short head of biceps, the pec minor and the coracobrachialis, so these could be a problem if this spot is tender. Then what we can do is come out laterally onto the greater tubercle of the humerus, which can be located by laterally rotating the arm in and out, and you'll feel the bony prominence moving under your fingertips. Tenderness here can indicate pathology of the supraspinatus, infraspinatus or teres minor, which all attach here. If you medially rotate your arm behind your back, you can feel the supraspinatus tendon 2 centimeters inferior to the acromion process. You can palpate the long head of biceps, which sits in the bicipital groove, which is between the greater and lesser tubercle of the humerus. And this is going to be palpated for bicep tendinopathy. What we can also do is palpate along the rim of the glenohumeral joint for pain. We can palpate the scapular spine, the medial border of the scapula, the inferior angle and the lateral border of the scapula. And we want to make sure we look around here for muscular atrophy, because this could indicate nerve palsy or acute brachial neuropathy, which is also called Parsonage-Turner syndrome. From the medial border of the scapula, we can palpate through the rhomboids, which is just between the thoracic spine and the medial border. You can palpate through upper fibers of trapezius. We can also look at the levator scapular muscle. So if we come to the superior medial border of the scapula, apologies about the hand in the way, but basically palpating through there and up towards the neck, so up towards C2 in the line of the muscle belly. Then if we find the spine of the scapula, so palpate the spine of the scapula, we can feel beneath that for the infraspinatus muscle, which is basically inferior to that spine of scapula across here. And we can palpate through and across to the posterior cuff and where lat dorsi would attach into.
If you're a physio or therapist looking to get better, then press the subscribe button, click the bell icon, and that way you'll see all our current videos that are coming out, and they're all designed around helping you to get better. Guys, if you enjoyed this video, then click this one here because you are going to love it.